Good afternoon. My name is Weidong Lu. First of all, thanks for the organizing committee give us an opportunity to presenting our case here. Our format is very different. Today we have a few minutes to work with Dr. Margalit and Mr. Smith, the patient here, to share with our experience using acupuncture and conventional medicine together how to help our patients. That is the ultimate goal of the medicine, help our patients. So we have a real patient here. So this is WHO data about cancer in the world. In 2012, there's over 14 million new cases of cancer in the world, and 8 million deaths occurred during that year. We all know the cancer is a big problem here. About 17 years ago, at Dana-Farber, because a person, his name is Zagam, Mr. Zagam, because of his idea, we established a unit called the Zagam Center for Integrative Therapies and Health Living 17 years ago. And the purpose of this, the center is try to integrate this practice of complementary therapies, which include acupuncture, into the traditional cancer treatment. 7 years later, and acupuncture has been a very important part in the cancer care at Dana-Farber, and we actually established a new subspecialty we call the Oncology Acupuncture. So what is the acupuncture? For people who don't know what acupuncture is, so that is the NIH, the statement. The acupuncture describes a family of procedures that are using stimulation of the anatomical location on the skin by the various techniques. Mostly we use is the needles and stick into the skin surface, try to elicit some system responses. This stimulation could be manual or electric stimulation. Well, because acupuncture is original from Asia, and because of the huge culture and language difference, it's very challenging to translating or integrating acupuncture into places like Dana-Farber. This is a bigger challenge. So this is me and treating a patient with the acupuncture at Dana-Farber. This is our team members, Oncology Acupuncture team at Zagam Center. We've been working there for 17 years. By looking at science, in past 40 years, as you can see, the publication in the PubMed on the topic on oncology acupuncture has increased substantially. So this field is growing very fast. Well, another force behind this is another organization we call the NCCAM. So what is the NCCAM? NCCAM is called the National Comprehensive Cancer Network. This is consists of over 20 most well-established cancer centers in the United States who issues guidelines to tell the oncologists how to use chemotherapy, radiation to treating cancer patients. You know what? NCCN also recommend acupuncture as a supportive care for cancer patients in these 5 areas. One is for the cancer pain. Second is anti-emesis, which you use acupuncture for chemotherapy-induced nausea, vomiting. The third is the cancer-related fatigue. The fourth is palliative care, using acupuncture as the last one. Acupuncture can play a role in the survivorship. So what it really is oncology acupuncture? Oncology acupuncture as a new subspecialty is using acupuncture in the field of oncology. It's very different than traditional acupuncture with these 4 distinguished features. Oncology acupuncture is a standardized procedure and have lab-based safety rules and evidence the protocols as well as the quantified outcomes. And the oncology acupuncture is using in all the aspects of cancer care continuum from active treatment to the follow-ups to the survivorship. So this is a snapshot in the past year that at the Dana-Farber, our oncology acupuncture team, we treated over 2,000 patients and over 300 patients with the air acupuncture at the infusion room. You can see here we see a lot of breast cancer patients, as hematological cancers, and also the prostate cancer, and gastrointestinal cancer, head and neck cancer, as well as lung cancer, brain cancer. So you can see our patients have very wide spectrum, covers all the cancers, and come to our clinic and looking for help. So today I want to specifically discuss one case with you, is the use of acupuncture for symptom management in the head and neck cancer. And for most of you probably don't know what a head and neck cancer is. And the head and neck cancer is a cancer mostly in the oral cavity, pharynx, larynx, sinus, and nasal cavities, basically in the top of your head. And it's relatively a small cancer because it only counts about 5 to 3% of all the cancer in the United States. In the worldwide, it's about every year is over 550,000 new cases of head and neck cancer. Head and neck cancer actually is very prevalent in Asia. In East Asia, like Hong Kong today, the people come from Hong Kong. There's a lot of head and neck over there. The current treatment for head and neck cancer is using surgery, radiation, and chemotherapy, and combination of chemotherapy and the radiation, as well as immunotherapy. Well, these are famous people. Some of you probably recognize the name. They all had head and neck cancer. I put the two Chinese people face there. For people who are from Asia, you probably recognize their name as well. So what does the acupuncture can do specifically for head and neck cancer patients? Based on the evidence generated from the research, the head and neck cancer patient can benefit from, one is that acupuncture can prevent and improve this radiation-induced xerostomia, which is called dry mouth. And also acupuncture could improve the function and the neck pain after neck surgery, which is very common in head and neck cancer patients. And possibly we all find that the acupuncture may improve the swallow-related quality of life in patients and shorten the feeding tube durations. In addition to that, acupuncture also could reduce other common symptoms that occur in cancer patients, such as anxiety and fatigue. So these clinical applications is really based on the evidence, the randomized controlled clinical trials. Just give you some examples. These are randomized clinical trials and specifically conducted in past few years. One is you can see here an acupuncture to prevent the dry mouth during the radiation time. Second is the acupuncture also could help the patient who had chronic xerostomia. What that means, chronic xerostomia, chronic dry mouth? That means that people, even for years after they complete the treatment, they still could have very severe dry mouth, and acupuncture could help that. The last one, and next one is acupuncture can help the pain and dysfunction after the radiation and after combination with the surgery. And the last year, we published a study at Dana-Farber, and we conducted randomized trials with the sham acupuncture versus the real acupuncture, try to see if the acupuncture could help the quality of life that's related to chemo radiation induced dysphagia, which is the swallowing difficulty. So these are all the clinical trials that support use acupuncture in clinical practice and help our patients. So the case here is that a 61-year-old male who has diagnosed with a squamous cell carcinoma on the left side of the base of a tongue. At that time, he was staged as a stage 4A, which is considered to be quite advanced. When he came to us, request for the acupuncture was on the December 11, and 2015. Well, his case is that in the early August 2015, he first noticed some kind of lumps on his left side of his neck, particularly notable when he's shaving. And then, of course, he went to his PCP, primary care doctor, and who confirmed he does have a lumps on his left side. And his doctor ordered ultrasound exam. And subsequently, he also obtained a CT scan on his neck, which found there's enlarged mass in his left side, and with multiple enlarged lymph nodes on his left side as well. Then he underwent this biopsy, fine needle aspiration, which showed he had P16 positive squamous cell carcinoma. Then he further undergoing biopsy in the operation room and confirmed his primary site tumor is on the left base of his tongue. That is his PET-CT scan at the time of diagnosis. So this is a PET scan, so this bright light, that's his tumors, and that is enlarged tumor on the left side with lymph node enlargement. So quite big tumors. Soon later, he started the treatment. His treatment was using this radiation on a daily basis, plus use a concurrent cisplatin chemotherapy once every 3 weeks for over about 7 weeks of a time. His treatment started on September 29th, 2015, which is the first cycle of the chemotherapy, and the same day he started radiation. The particular radiation style is called the MRT. The dosage was 7,000 C gray, which is considered to be a very high dose of radiation. And he continued. In the August, he started being put into called a PEG tube. That is a feeding tube because he was not able to eat food during the time. He continued to receive chemotherapy 3 cycles, and he completed by November. He completed his 3rd cycle chemotherapy, and 1 week later, he finally finished his daily radiation. And approximately, as you remember, he came to us for acupuncture is approximately in the December, which is approximately about 1 month later. When he came to us, he had a lot of symptoms. Most symptoms, including he could not taste any food. Lots of taste. He had also very severe xerostomia, very dry mouth. And he also is very fatigued. I can imagine he couldn't sleep. He also could not eat. He mostly using these 4 to 5 canned liquid food through his feeding tubes, plus one high protein shakes. He tried to eat after finishing reading. He tried to eat some wonton soup, noodles, but he had trouble to do that. He also had some constipation, other symptoms. He also his sleep is not quite well because he had to wake up every hour to drink some water because of dry mouth. Well, he tried to exercise, do some swallowing exercise as well, try to recover as much as he can. And at that time, he did not have a tingling numbness on his feet and hand, which then means that he did not have symptoms of neuropathy, which is another side effect from the treatment. So what is feeding tube? Feeding tube, that's a particular one had called a PEG and percutaneous endoscopic gastrostomy. That's the feeding tube used for the patients who could not eat. Basically, it surgically dig a hole on your stomach and put a tube there. So you could use the liquid food through the tube since that the patient's throat has been severely impaired by the radiation or surgery, etc. So many head and neck cancer patients had to carry the feeding tube for very many months to come, even after he completed the treatment. So this was a symptom score at the time of visit. As you can see, the symptom score is based on the 0 to 10, 10 being the worst. As you can see, he has a symptom score and on the very moderate to very severe stages. Mostly consist of fatigue, dry mouth, lack of taste, and insomnia. So he started treatment. He started treatment on the daily basis. And actually, his treatment history of acupuncture divided 2 phases. The first phase is from December of 2015 to the June 2016. Then he took a break. He stopped. And early this year, 2017, he came back for a new set of symptoms, and he started phase 2 treatment. So that during these 2 years of time, he actually received about 56 acupuncture treatment. The first phase and twice a week for 50 times, and the second time is still continued at once a week on that basis. This slide showed that his number of his visits to our Dana-Farber specialty. As you can see, he utilized heavily, of course, the head and neck oncology, but second to that, he used a lot of integrative medicine approach to help manage his symptoms. At the end of his phase 1 acupuncture, we can see his fatigue almost disappeared. And his dry mouth was somewhat pretty persistent, and but his taste and insomnia has a clinically significant improvement. His symptom score has dropped. So this example about the percentage change from baseline about his lack of taste score, and by end of his phase 1 treatment, he had about approximately 40 to 30% reduction on his symptoms. And this is the fatigue score reduction change, percentage change from baseline, and his fatigue was almost complete 100% resolved by the end of phase 1 treatment. Well, early this year, 2017, he came back, and he has continued to have some dry mouth and a lack of taste, although they somewhat improved as compared at the beginning when he started. But he had a new set of symptoms. He has feel the tingling numbness on his hands and his feet, which indicates he developed this side effect called chemotherapy-induced peripheral neuropathy, which is damaging of his nerves on his hands and feet. So we started a new set of acupuncture treatment to try to help improve his neuropathy symptoms. Well, he responded quite well. After full treatment, his neuropathy symptoms had reduced by 36%. And he continued treatment at this time. He still come to see us on a weekly basis. So now let's welcome our patient, Mr. Smith. He's here with us, and he will tell you his personal experience. Let's welcome.
Thank you, Dr. Lu. My name's Howard Smith, and from a patient perspective, I'm very grateful to be alive and to be here to share my story with you. And so I first received extraordinary treatment from Dr. Margalit and her colleagues in the head and neck program at Dana-Farber, followed by extraordinary treatment from Dr. Lu at the NCCAM Center, followed by my participation in a community survivorship program known as the Livestrong program. And looking back, and the simple point I really want to make today is that these 3 different phases of my treatment somehow came together like stepping stones and enabled me to really have a successful journey through all of these hazards of treatment. And to the extent that I've had a good outcome, I don't really attribute it to anything other than really listening carefully to what the doctors had to say to me, to working hard at the things they asked me to do on my own, and then sort of just making it to the finish line while taking advantage of the opportunities that the Farber presented to me. So I'm going to defer to Dr. Margalit on the content of my treatment, but I just want to spend a minute talking about the effects of my treatment. And so going in, the head and neck team did an extraordinary job forewarning me how this treatment would go and that it would compound week after week. And I listened to that, but really couldn't appreciate exactly where this was going. And so after the first week, everything seemed okay, but that sense of things staying normal changed very quickly by week 2, which was twice as bad as week 1, and week 3 was 4 times as bad as week 2, and so on. And so I believe by week 3, I had really lost my ability not just to swallow, but to consider eating, or barely able to drink water and so forth. And so just in time, I had this feeding tube inserted. And I would say from there, the treatment quickly spiraled, or the effects of the treatment, rather, spiraled quickly in a downward basis, both mentally and physically. And so I was going into the Farber every day for morning radiation. I was seeing nurses and nurse practitioners in the clinic. I was going home and really trying to get out every day for a walk. But other than that, and other than trying to maintain my nutrition through the feeding tube, I had pretty much shut down everything. And over time, it wasn't like there was one specific problem I was having with this or that, but I began to experience a sense that physically and mentally I was just wasting away. And I was certainly losing a lot of weight. I was losing all my energy. And I recall by the time I walked out of my last radiation visit, it was like the walls and the floor were no longer perpendicular to each other. And there was a certain effect of being in the twilight zone. And so I had really sunk into the bottom of a ditch, and I was really at a point where I myself wasn't thinking, what could I do for myself? Like that concept of self-help had really, I think, left me. And that's when I had the time, because when you start this treatment, you get a printout of your appointment, and the printout goes 25 single-space pages, and there's more appointments than you can imagine adding on. But when treatment ended, and I had this effect of being a baked potato that was still cooking, though I was out of the oven, Dr. Margalit then said, now's really the time to get to the NCCAM Center. And not knowing what that meant, I went to see Dr. Lu and his colleagues, and I really had no prior experience with any holistic medicine. I hadn't ever done yoga or Reiki or any of that, and I was really it was really unknown to me how my symptoms or how my issues were going to translate into treatment. And it wasn't like I prioritized one symptom over another, but somehow I think Dr. Lu knew what to focus on. And it seemed that the focus were a series of needles throughout my body involving and including electrical stimulation to the needles that were in my head. And I couldn't really understand what the design of the treatment was or what the objectives of the treatment was, but I certainly went at it with an open mind, willing to take the treatment wherever it may have led to. And so in my case, in most cases, the treatment would put me not just into a sleep, but like this deep state of unconsciousness where I was just, I had left the building, so to speak. I really could only say that when I woke up, it would take me more than a few minutes to recover and regain my sense of time and place and so forth. And so in the meantime, I still have the feeding tube in, and I'm still struggling to gain weight, and I'm not going anywhere. And the fatigue is overwhelming, and it was moderately depressing. And at this point, the treatment I'm receiving is exclusively from Dr. Lu. And in particular, the feeding tube was causing me extraordinary distress. I wasn't able to hug my wife, I wasn't able to exercise, and it left me with a feeling of total vulnerability. And so I want to just describe what happened in this one particular session where I'm laying on the acupuncture bed and the needles are in my head and the electrical stimulation pack is connected to by the leads to the needles. And this is all going to sound a little strange, but this is exactly how it happened. And the electrical stimulation produces these patterns or waves of energy that rippled through my skull on a pattern. And I could sense this pattern, and this one time, instead of falling asleep, I was awake to an extraordinary degree, and at some point I felt like I just had reached this level of clarity where perhaps I felt like I was rising off of the bed, but it was a very cerebral state. And again, these ripples are pulsing through my head. And at that point, all of my treatment came into perspective. All of the radiation treatments, all of the visit to the basement at the Farber building, the infusions, all of the needle sticks, all of those biopsies, the nausea, the vomiting, the constipation, the sleeplessness, the dry mouth, the lack of eating, it all came into perspective. And then this next thing happened, and this is a little odd, but I began to hear the words to a song, and the song that I heard was a ballad that the Grateful Dead and Jerry Garcia sing called Stella Blue. And the lines I heard at this point were that all the cards were down and there's nothing left to see. And at that moment, to me, what that meant was that everybody at the Farber had done everything they could for me, and that it was time for me to go home and to start eating by mouth. And so in order to get the feeding tube out, the standard was that I had to go 2 weeks eating only by mouth without losing weight, which seemed next to impossible. But that was the objective as I got home that day, and I started eating oatmeal and wonton noodle soup. And pretty much those were the only things I ate for the next week or two, I believe. And as that week or two scrolled by, I was looking at my weight, and I'll tell you all that I was so determined to get that feeding tube out that if it became necessary to put weights in my pocket, I absolutely would have done that. But it wasn't necessary, and so the 2 weeks went by, and I got cleared to have my feeding tube out, which was an extraordinary thing for me. And so now I'm in with the nurse practitioner, and he's physically pulling the tube out. And I'll get back to the acupuncture in a second, because that's very important. But at that moment, I'm sitting there with the nurse practitioner, and I asked him, like, what should I be doing next? And he turned to me and said, well, you should try and find a Livestrong program. And so for anybody who's not familiar with that, there's a Livestrong Foundation that has these survivorships across the country. And to my good fortune, a Livestrong program was just starting up within a couple of weeks at my local YMCA. And so I got clearance, and I couldn't have done this if the feeding tube was still in, because, as I said earlier, having a piece of surgical tubing hanging out of me just I felt very exposed and vulnerable, and I never would have gone to a gym with a feeding tube in place. And so I do believe that getting the feeding tube out on an accelerated basis in turn allowed me to enroll in this Livestrong class, so that in that sense, one good turn led to another. And so I'll get back to the Livestrong program in a second, but I just want to continue my comments on acupuncture. And so I had two types of responses to acupuncture. Responses that were extraordinarily fast, or responses that were slow and steady. And so I think getting the feeding tube out was an example of a fast response to the treatment I was receiving from Dr. Lu. The second was in this most recent phase of acupuncture, and I went back and commented that the neuropathy in my feet really hadn't improved, and that walking barefoot felt like walking on rocks. And so Dr. Lu again put electrical stimulation connected to the needles in my feet. And this is gonna again sound strange, but literally after the first session, I felt sensation in my toes that I had not felt since my feet were numb. And so just to put it in perspective, though I had feeling all along in my heels, everything forward from my heels was numb and painful. And after this first session, followed by more improvement after the second and third session, on each visit I began to recover sensation in my feet. And it all just seemed extraordinary to me that the turnaround could have happened that quickly. And so I'd just like to say, this past weekend I was walking barefoot on the beach, and it was all good. It's my time, Bernard? So I guess in summary, I just want to say, that there were transformative effects from the acupuncture that were both quick and slow and steady, that I got extraordinary treatment, and want to thank everybody up at the Dana-Farber, and I want to thank my wife for being with me from the start to finish through the treatment. Thank you.
Thank you, Mr. Smith, his personal experience. What I have this one slide to show you is that this is the median feeding tube duration in many studies. We published studies from 360 days patient carry after they finish the 360 days, down to recent we finished the randomized trial at Dana-Farber 125 days. Mr. Smith, his feeding tube days is 79 days. All right, so now let's welcome Dr. Margalit. She is Mr. Smith's radiation oncologist. She personally treated him, and she would like to give us a perspective.
Thank you. So I will just briefly talk a little bit about the radiation therapy aspect, I think perhaps mostly to highlight the unmet needs. And there are a lot, and there are a lot of thinkers here and doers. So hopefully this will cause you to think about perhaps how you can contribute to solving some of these acute and long-term problems that Mr. Smith just spoke about. So, excuse me, when we speak about a radiation therapy, the goal is to maximize the therapeutic ratio, and that's done by maximizing the chance of cure, giving adequate dose to the tumor, and minimize the chance of side effects, meaning decreasing the amount of dose that goes to normal tissue. And in head and neck cancer in particularly, there's a really nice a trend, which is that over the last few decades, the survival rates have improved dramatically. And this is some data from North America, from SEER, just showing increase in median survival, particularly in oropharynx cancers, so base of tongue, tonsil, the back of the throat. And that's driven partly by improved therapies and partly by the increasing role of virally mediated cancers. And so with the improved survival, there's a growing emphasis on survivorship and how do we take care of these long-term side effects, since patients will go on to lead a good long life. So when we do a radiation plan, we create a dose map, essentially, and this is shown here. For example, you can see everything inside the yellow line is getting a dose of 70 gray. So that's a fairly high dose, a dose that's been established after many years of clinical trials. But to get the radiation in, we have to pass through normal tissue, and the tumors themselves are embedded in normal tissue, and hence the side effects. So again, cure rates are high, but the side effects relate to the normal tissue. And so, for example, when there's dose to the salivary glands, people get dry mouth. That can lead to dental cavities. When there's dose to the mucous membranes, people can have taste loss or mouth sores. Dose to swallowing muscles can cause difficulty swallowing. We've heard about the feeding tubes that are used. And when there's dose to the jawbone, it can cause long-term problems with the bone. And there's been a major shift in head and neck radiation, where older techniques have used simple fields where
Okay, so Dr. Margalit just didn't have lunch today, so she's worked too hard for our patients. And thank you for her to continue clinical contribution. As you can see, this, the radiation has improved a great deal to improve the survivorship, but also bring some side effects in our cancer patients. And so this is just summarize some of the usage of the acupuncture in our practice. In the active treatment, this surgery, chemotherapy, radiation, and the hormone therapy, and the acupuncture could play a role in all different stages. particularly for symptoms like pain, nausea, vomiting, hot flash, dry mouth. They all have a clinical approved evidence to support use acupuncture for this setting. And particularly in the follow-up and survivorship, this is another great area for the acupuncture to work our patients to help improve their quality of life. So basically what we try to say here is that traditional therapy could play a role in the conventional cancer treatment, but it should be supported by the continuous research and supported by the clinical evidence to integrate the acupuncture into a conventional cancer care. So this is our presentation for our case study here today. Thank you very much, and we'll probably later on, if you have questions, we'll be here for you. Thank you.